Hello and welcome back to GP Video Podcast by Nadia. So if you guys remember, day before yesterday, I started a video podcast on RACGP's Red Book. What is Red Book? Red Book is all about the guidelines for screening and prevention of different diseases in different life cycles of adults and kids. And that is basically designed for general practitioners to be able to go through it whenever they see a patient, depending on their age, their gender, and the kind of conditions that they can get, to be able to talk to them about screening and prevention. As you guys know that prevention is better than cure. That's why I think not only GPs, patients and general population should also know that what are the conditions that they need to get screened for, and what are the conditions that they can potentially prevent from happening in the future. So it's not only about cancers though. There are so many conditions that this whole RACGP Red Book has, like cardiovascular conditions, metabolic conditions, respiratory conditions, many conditions. So you should definitely know that in your age group and according to your gender, what are the conditions that you should be going to your GP for screening and prevention. So we will start with, I gave you a bit of overview about the book the other day, but we will start with the cancers, of course, and I will go through different cancers and what are the age groups that need to be screened for, and then what are the cancers that we don't even have a screening program for. So the cancers that I'm going to talk to you about in this RACGP Red Book is bladder cancer, breast cancer, cervical cancer, colorectal cancer, lung cancer, oral cancer, ovarian cancer, pancreatic cancer, prostate cancer, skin cancer, testicular cancer, and thyroid cancer. So these are the cancers mentioned in RACGP Red Book. So we will go through them one by one to look at which are the cancers which we really need screening for. So we will start with bladder cancer. So it is said that it is estimated that in 2023, more than 3,100 people were diagnosed with bladder cancer, which is urinary bladder, in Australia. Incidence and mortality of bladder cancer is approximately 3 to 4-fold higher in males than females. So incidence, like the occurrence and mortality, means the death rate of bladder cancer is approximately 3 to 4 times higher in males than females. So what is the table of recommendations? It says that screening for bladder cancer in asymptomatic adults is not recommended because there is insufficient evidence to assess the benefits of the balance of benefits and harms. So it is not recommended. So we can, fortunately or unfortunately, I don't know how to put it, but there is no screening program available for urinary bladder cancer in any age for either gender. And there are no considerations or no specific recommendations for Aboriginal and Torres Strait Islander people either. So what do we do about that? Still, it is like, a commonly prevalent cancer. So urinary bladder cancer, again, if there is any family history, then keep an eye on the bladder symptoms, urinary bladder symptoms. Like, for example, if you have any urine in the, any blood in the urine, which again can be suggestive of anything. It could be kidney stones, it could be kidney infection, but just keep an eye if you have blood in your urine. So please go and get it checked. Please go to your GP, or if you have any other symptoms, like usually males get lower urinary tract symptoms, like urgency, irritation, and that is usually attributed to prostate. But yes, if you have any urinary tract symptoms, and especially if you have family history, then please go to your GP and get yourself checked out. But there is no screening in asymptomatic adults. Basically, I would like to tell you that as well, that screening is basically for people who are asymptomatic. People who have symptoms, they go for checkup and treatment. while screening is usually for people who are asymptomatic, but how do we grade them into average grade and high grade is because of the family history. Family history is very, very important in various cancers, and then we usually grade them. I will come to that topic when we talk about other cancers. Our next topic would be breast cancer, but that was a small preview for bladder cancer, that there is no screening present for bladder cancer in Australia at this stage, and screening of asymptomatic individuals, which are usually the people who are screened, is not recommended because there is no evidence, insufficient evidence to assess the balance of benefits and harms. But of course, people who have symptoms, they should be really vigilant about it and go and get themselves checked. See you tomorrow.